Do you know how many sexually transmitted diseases there are and how they can affect you? Today, we'll be delving into a subject that is often shrouded in stigma and misunderstanding: sexually transmitted diseases, or STDs. It's important to note that these diseases can impact anyone who is sexually active, regardless of age, gender, or sexual orientation. STDs are infections that are passed from one person to another during sexual contact. They can be caused by a variety of microorganisms, such as bacteria, viruses, and parasites. The symptoms can range from mild discomfort to life-threatening complications. The good news is, most STDs can be prevented and many can be treated. This makes understanding what they are, their symptoms, and how to protect yourself from them absolutely essential. We'll be discussing 20 common sexually transmitted diseases. For each, we'll cover the symptoms and available treatments. We'll also talk about preventative measures you can take to protect yourself and others. While some of these diseases may sound scary, remember that knowledge is power. The more you know, the better equipped you are to make informed decisions about your sexual health. It's important to remember that if you think you might have an STD, don't panic. Many STDs are treatable, and there are resources available to help you navigate your options. Remember, maintaining good sexual health is not just about preventing disease. It's also about understanding your body, respecting your partners, and taking care of your overall well-being. Finally, it's important to mention that this video is intended to be educational and should not replace professional medical advice. If you have any concerns about your sexual health, it's always best to consult with a healthcare provider. So to protect yourself and others, it's important to be aware of these diseases and their symptoms. Stay tuned as we delve into the details of these 20 sexually transmitted diseases. Now let's dive into the details of 10 common STDs, their symptoms and treatments. Firstly, we have chlamydia. This is often silent, but when symptoms do appear, they can include genital discharge and pain during urination. Treatment typically involves antibiotics prescribed by a healthcare provider. Next up is gonorrhea, which shares similar symptoms to chlamydia, with the addition of pelvic pain. Again, antibiotics are the usual course of treatment. Then we have syphilis. This disease presents with a sore or rash, followed by flu-like symptoms. Early detection is crucial, and treatment involves antibiotics. Fourth on our list is genital herpes. This disease is characterized by painful sores or blisters in the genital area. Antiviral medication can help manage outbreaks. Moving on, we come to the human papillomavirus, or HPV. This is often asymptomatic but can cause genital warts or even lead to cervical cancer in some cases. A vaccination is available to prevent certain strains. Next, we have HIV/AIDS. Early symptoms mimic the flu, while later stages can lead to severe immune deficiency. Antiretroviral therapy can manage the condition, but as of now, there is no cure. Then we have hepatitis B and C. These diseases can cause symptoms such as jaundice, fatigue, and abdominal pain. Treatment involves antiviral medication and lifestyle changes. Eighth on our list is trichomoniasis, which may cause symptoms like itching, burning, and discharge. Antibiotics are used for treatment. Then we have scabies, which causes intense itching and rash, commonly in genital areas. Treatment for this involves topical creams to kill the mites. Finally, for this section, we have pubic lice, also known as crabs. Symptoms include itching and visible lice in the genital area. Over-the-counter medications can help eliminate them. That covers the first half of our list. But there's more to come. Let's continue with the rest of the list. First up is Mycoplasma genitalium. This STD can lead to symptoms such as urethritis, cervicitis, and even pelvic inflammatory disease. Antibiotics like azithromycin or doxycycline are often prescribed for treatment. Next is molluscum contagiosum. This one presents with painless, small bumps on the skin in the genital area. Treatment may involve topical creams or procedures to remove the lesions. Following that, we have lymphogranuloma venereum, or LGV. This STD can cause painful swelling of lymph nodes in the groin, along with rectal pain and discharge. Antibiotics are typically the go-to treatment for LGV. Next on our list is granuloma inguinale. This causes painless ulcers or bumps in the genital area. Antibiotics such as doxycycline or azithromycin are often used for treatment. Donovanosis, also known as granuloma inguinale, presents with painless, beefy red ulcers in the genital area. Treatment typically involves antibiotics like azithromycin or doxycycline. Next up is chancroid. This STD causes painful sores or ulcers in the genital area, along with swollen lymph nodes in the groin. Antibiotics are the usual course of treatment. Next, we have genital warts. These are small fleshy growths caused by certain types of HPV. Topical treatments or surgical removal are the common treatments. Ureaplasma ureolyticum is next. This can cause burning during urination and unusual discharge. Antibiotics are typically prescribed for treatment. Penile yeast infection comes next, often causing itching, burning, and a white discharge. Antifungal creams are usually effective. And finally, we have nonspecific urethritis, which can cause pain during urination and unusual discharge. This is typically treated with antibiotics. And that completes our list of 20 STDs. We've covered a lot of ground today, discussing 20 different sexually transmitted diseases. We've delved into the details of these conditions, their symptoms, and potential remedies. We've talked about everything from chlamydia and gonorrhea to molluscum contagiosum and donovanosis. Remember, some of these diseases can have severe consequences if left untreated, and many can be prevented with safe sexual practices. It's crucial to get regular checkups and to consult with a healthcare provider if you suspect you may have been exposed to any of these diseases. We've also discussed the importance of early detection and treatment. For many of these conditions, early intervention can make a significant difference in the prognosis. So don't hesitate to seek medical help if you notice any unusual symptoms. It's also worth mentioning that many STDs can be asymptomatic, meaning you might not show any symptoms at all. This doesn't mean you're in the clear. Regular testing is essential, especially if you're sexually active with multiple partners. We hope this overview has given you a better understanding of these diseases and the importance of sexual health. It's a topic that doesn't get discussed as often as it should, but it's vital to overall well-being. Let's continue to break down the stigma surrounding these topics. Open conversations about sexual health can lead to better understanding, prevention, and ultimately healthier lives. Remember, knowledge is power. Stay informed, stay safe. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more informative content. Remember, your health is in your hands.